Hello, my name is George Williams, and this is my teaching project in effective teaching and learning strategies with faculty Dr. Bryan at Georgia Southwestern State University. Here is the outline, and let's just get right into it. This teaching project focuses on helping patients prepare for total knee replacement surgery. It will take place during preoperative visits where nurses have direct access to patients. Many patients feel scared or confused before surgery, which can lead to serious recovery problems. The teaching plan aims to reduce that risk. It will showcase simple, direct instructions using printed materials, models, and visual aids. Nurses will use plain language and repeat core points. Sessions will remain short and focused since most patients are older adults. Thus, content will follow a slow pace and include repetition. The teaching will allow time for direct questions, and the project uses SMART objectives to guide the process and evaluate patients' understanding. The teaching project has three goals, and each goal focuses on patient needs before knee replacement surgery. The first goal is to give a 20-minute session that prepares patients for the hospital process and reduces confusion. Many patients feel lost or forget key steps, and this goal addresses that problem directly. The second goal is to help patients understand how to recover safely and use a walker correctly. Falls are a serious risk, and proper teaching lowers that risk. The third goal is to lower anxiety by using plain language, printed materials, and simple hands on tools which support patient comfort and trust. The project uses four SMART objectives to showcase what the patient must do before the session ends. The first objective asks the patient to name 3 surgery day steps using verbal recall, which checks memory and understanding. The second objective asks the patient to demonstrate correct walker use with guidance. It shows they can repeat the physical task correctly. The third objective asks patients to name 2 home safety steps since they will do this after reading the printed handout. The fourth objective checks if the patient can raise the correct leg using a pillow and model. The teaching project uses a short and structured session led by a nurse educator. The session will follow a printed outline and include large visuals with clear steps. Each part will use simple terms and repeat the same ideas in different ways. The nurse will model actions first and then ask the patient to repeat them. The method allows direct correction if the patient does not complete a step properly. Questions will be encouraged at each stage, and written handouts will match the pictures shown on the screen. The teaching strategy must work for older adults who may struggle with memory or vision. Many patients feel serious anxiety before surgery, which is why the tone will remain calm and clear. Most patients needing knee replacement surgery are over 50 years old. Some live alone, and others have memory loss or pain that distracts them during conversations. Patients might not read well because clear pictures and simple instructions are highly important. The teaching strategy works because it uses handout steps and spoken review. Hence, it keeps the patient active and improves memory. Printed instructions will use large letters and short phrases. The strategy will follow a step-by-step order and avoid medical terms. Each part gives the patient a direct task, such as pointing to a swollen area or repeating instructions. The strategy allows quick correction of mistakes since support patients who may feel fear or confusion. The nurse will test learning using simple questions and short demonstrations. Each patient will answer orally and complete 3 short tasks before the session ends. One task asks the patient to explain how to use a walker correctly. Another task asks the patient to list 3 steps for discharge safety. The last task checks their ability to raise the correct leg when asked. These tasks match SMART objectives and help spot any problem. If the patient gives a wrong answer or performs a step incorrectly, the nurse will repeat the explanation directly. Each task links to a core goal, and the test does not need grades, but it gives quick feedback. The teaching session will use printed handouts, joint models, photos, and a large poster with steps. The photos will show each action clearly with no medical terms. Each picture matches a phrase the nurse says out loud. The poster stays in the room for easy review, and the nurse holds the model neat and points to each part directly. Patients can hold the model and repeat each motion, and the handout uses bold font and plain words. It will include space for the patient's notes because some patients can forget information, which is why they take home the printed page. The nurse gives the handout after the session, not before, since such an order avoids distraction. The project supports safer surgery preparation for patients who face serious risks and stress. Many tend to struggle with memory, fear, or physical problems. Therefore, the session is short and direct. Each step matches one SMART objective, and teaching uses the same tool every time, which keeps the message clear. The nurse gives patients time to repeat steps and ask questions. Printed materials and models parts help patients remember what to do because this method keeps instructions slow and simple. Hence, it works well for the given population. The nurse watches for signs of confusion and corrects errors directly. And that concludes my presentation. Here are the references in APA format. Thank you and have a good night.